How to treat an unconscious choking adult or child. If food or an object becomes stuck in the throat and blocks the flow of air, the flow of oxygen is cut off to the brain, and the person will eventually lose consciousness. It's always helpful to be prepared to treat an unconscious choking adult or child using the Red Cross recommendation of cardiopulmonary resuscitation, CPR. The treatment is slightly different for a child under the age of 9, while children under the age of 1 require infant CPR. Lay the unconscious choking adult or child on the floor. Kneel next to the victim's shoulders, so you are in position to perform CPR. Attempt to remove any visible blockage in the throat without forcing it deeper into the airway. Reach in with your finger and make a sweeping motion to try to dislodge the blockage. Perform CPR if you can't remove the blockage, in the hope that the chest compressions will force it out. Place your hands on top of each other and center the heel of your bottom hand between the choking victim's nipples. Push your full weight onto the victim's chest, keeping your elbows straight. The chest should compress at least 2 inches, 5 centimeters. Continue at a rate of 100 compressions a minute. Pause after a minute to check in the mouth to see if the blockage has been forced out. Continue with step 3 and 4 until the victim begins to move or emergency personnel arrive. If you have received formal CPR training, alternate the chest compressions with rescue breathing. Check for the pulse of the child after 5 cycles of 30 compressions after compressions. Treat an unconscious choking infant. Lay the infant face up on the floor or a table. Look for a visible object in the mouth and try to remove it with your finger without pushing it deeper into the airway. Tilt the infant's head back slightly to open the airway. Place your ear close to the infant's mouth so you can listen and feel for a breath. If the baby isn't breathing, continue with the next steps. Cover the infant's mouth and nose with your mouth and give a quick, short breath. Let the air come out and repeat once more. The infant's lungs are much smaller than yours, and you don't want to damage them. Perform chest compressions at a fairly rapid rate of 100 compressions per minute. It may help to count aloud. Imagine a horizontal line drawn between the baby's nipples. Find the center point between the infant's nipples and place 2 fingers from one of your hands slightly below that point. Press the pads of the 2 fingers into the chest to compress at 1.5 inches, 4 centimeters. Continue compressing 29 more times. Check if the baby is breathing. If not, repeat the 2 breaths followed by 30 chest compressions. Continue checking for a breath and performing CPR until the infant becomes responsive or emergency help arrives.